thanks so much for joining me today. My name is David Nutting, personal trainer of Club Greenwood. We're going to go through some shoulder pain treatment. If you're having limitations as far as some different motions and movements that you're experiencing maybe recently, what I want to take you through are some exercises that might help to alleviate that pain. Now, the first thing you want to do is be able to, of course, get some help with that area. So if any of these exercises hurt at all while you're doing them, you don't want to do them. And you want to seek some treatment, seek some help from a physical therapist. A doctor can kind of help to refer in that area. First, let's look at the bones. The bones are the clavicle, the humerus, the arm bone coming down here, and then that scapula. What we're going to do is we're going to work in all those different muscles surrounding those areas, because a lot of times the impingement, the rotator cuff, those different movements, that's limiting the movement, and I want to take you through what's taking place. So let's get started. All right, the two most common themes that we probably see for the shoulder side of things is going to be impingement and then the rotator cuff. Let's work first actually with the rotator cuff. Very common, 4 different muscles. Rotator cuff is working, so think of your shoulder sitting on a ball in a socket. When the ball in a socket kind of creates hinge movement where it's going to get tight and restricted on different motions, it doesn't allow that mobility through that joint. And so we want to be able to allow that mobility. The 4 muscles of the rotator cuff, supraspinatus, so that's going to work with this angle, 15 degrees coming out on the shoulder abduction. Infraspinatus and teres minor, those are external rotators. So that would be if you have a band or a cable, you do external rotation. You want to keep a towel there a lot of times just so your arm's not flaring out. And then subscap or subscapularis, and that's internal rotation, pulling all the way through. The first exercise you want to do after you kind of find a little assessment. So a little assessment would be if you can bring your thumb down and you can't bring this arm up with any type of tension, then that's usually going to be a rotator cuff. Same thing if you start with your hands here and have someone kind of push slightly inside in there, that's the infraspinatus. And teres minor, we're kind of seeing what strength in that area. If you have trouble kind of bringing the arm up and you have to shift your body back, that's usually rotator cuff. So let's start first. The first exercise is going to be a pendulum swing. Usually the circle is kind of the most common one, but let's start actually with a little bit of rehab. And so we're going to shift the hips. All you're going to do is just kind of shift back and forth. Then you would go forward and back, and then you're going to do some circles. So let me explain what's taking place. You could always add a dumbbell, but think of that shoulder in that ball and socket. That shoulder coming forward is now able to relax. It's a passive movement, passive motion. When that works in that area, that's called scapular protraction. Think of the shoulders being here, and now the shoulder is able to relax. Kind of think of it's able to just basically be in a position where I don't have to strain to be in that posture position. It's allowing it to relax. So you want to work through those daily. A lot of these shoulder exercises you could do kind of even just even hourly if you feel like you're feeling and experiencing some pain. Second exercise is just get some retraction. So just get those arms and pull straight back. Just get a nice good squeeze. Hit the road jack is another one. It's kind of more what we call a face pull, but just do it with body weight. Start with the arms out and then you're flaring out. Now my elbow's over here, I turn the palms in on that neutral position, easier on the rotator cuff, getting that external rotation to that infraspinatus and teres minor. I've worked with the shoulder a lot throughout the years, and these ones are just kind of some good simple ones. Okay, after that, then you want to work through scaption or Ys. So once you kind of get some good movement and development in those areas, if you don't feel any pain, start with the arm here. And all you're going to do is just let that arm come out just about a 45-degree angle. I like to have the thumb up. That's a neutral position. And then it's coming out at that angle. The reason it comes out at that angle is if we come straight out here, first 15 degrees, remember, is that supraspinatus. Then that goes into the medial deltoid. And that's going to start restricting motion in that area. This one opens it up. So the muscle we're getting is anchoring back in through the shoulder area, that thoracic area. So we're kind of getting that movement. And then we get both sides. Great exercise. Start with no weight. Just kind of start with the movement. See how you feel. Make sure that feels okay. and then be able to add some really, really light weight, but you want to feel it between the shoulder blades. Just do that on a daily basis. Start opening things up. Okay, continuing on with the rotator cuff, you're probably familiar with internal, external rotation. What you want to do on these is you want to grip tight. So the grip, you have more nerve endings in your hand than you do through your arm and through your shoulder. When you do, that packs in and stabilizes the shoulder. What you also want to work on is your breathing. So as you're doing any exercise, just any everyday function, breathing. Put your hands down on your diaphragm right below your ribs and feel that expand. In through the nose and out through the mouth, and try to just work on through that breathing. So that's a good beginner on starting. Grip things tight and try to increase that grip. If you have any kind of hand grip or anything, that would help as well. Also, what would help is if you have a band, wrap it around something, or a cable machine, you're gonna grip tight. A lot of times what the physical therapist teaches to put a towel here, so that helps as well. And then don't have a lot of resistance, really light. I'm just coming right in front and then just flaring out, just like that. 15 reps is what I'll have my clients do, and then do the other direction. So now let's say if the band is over this way and it's wrapped there, all I'm doing is I'm pulling over and across if it's resisted in that area. So those muscles that we're working, infraspinatus and teres minor in that area, and then the subscapularis as I'm pulling back with internal rotation, making sure I'm not collapsing that shoulder. Do 15 reps on those. Try to do 1 to 2 sets. You want to do those also before a workout. Now I'm going to give you a lot of different exercises. You don't need to do every single one every single day or before each workout, but take the ones that you find that are working for you, that don't cause pain, and they're going to help to free up some of that movement for you. Okay, also what's going to help on the rotator cuff, there's a lot of things. This one as well. Think of if there was a table. I'm just kind of putting a ball on a really small kid chair here, and that's going to help. All you're going to do is you're going to put your hand down. You want to push down on anything, a countertop, anything you can, and then just slowly walk back, creating that range of motion there through it, and then you're walking yourself kind of back up in through it, and then reset. So you want to push down, lengthen, don't let any pain happen there. Push down, drop the hips back, and you're creating good range of motion. So we're getting that area to kind of open up to free that range of motion, okay? What we're also gonna do, if you have any kind of like a broomstick or a dowel rod, we're gonna create some internal rotation. So what you'll do is you're gonna grab here, back behind. So let's say like my pain, my restriction is more on my right side. Usually it's gonna be on the right side for most people. You're gonna grip from here, grip tight, and then what I wanna do is pull up, just like that. So there I'm creating range of motion in that area. Working with posture alignment also helps as far as impingement as well as rotator cuff. This one is you're gonna have the hand back here. So I'm creating internal rotation here on this one. Hand forward, hand at your right next to your hip, and all you're doing is just driving back. Without flaring out, you can see palm here, pushing back, palm up on this one. So if you can kind of practice with me on this one, and then you're just kind of opening. Now that keeps opening up that shoulder joint, that internal rotation, and then you would switch, try that other side. It's always a good idea to even just get both sides. Otherwise you're gonna start really freeing up one side, you're gonna see a lot of range of motion. That other side is gonna stay pretty much dormant, even though it's healthy, but you wanna keep creating range of motion on that side as well. Okay, with impingement, a lot of times you're gonna think of kind of posture. So think of that shoulder wants to kind of come forward a little bit. So what we wanna do is open up posture. Ways to find out if you're feeling that impingement. One is if you place your hand on your opposite shoulder, lift that elbow up, and this kind of drive up just a little bit. You could also kind of push back. If you feel any kind of tightness or pain in that area, there's a little bit of impingement going on. And then try both sides, kind of get a comparison from one side to the other. Another one is just clasping the hands and then just kind of pulling, seeing if you feel any kind of resistance, switching hands. You get a little type of resistance there. So opening up that pec minor. So I've talked about this on some of my other videos. We have the clavicle, the anterior deltoid. Right in here on this muscle is called the pec minor. Taking a ball or even your hand, just kind of pushing in there a little bit. Working on big deep breaths, that's going to help to open up that shoulder. Other things that will help with the impingement side of things is by getting some good opening there through it. So what we want to do is even, let me grab this real quick, is grabbing a foam roller. This one's a nice, easy, lazy man's way to do it, and we all love it. So you're going to open up, just like that. We're trying to open through here, and just resting back here. You could actually rest here up to 3 minutes, which would be really beneficial. Just begin opening things up really good around that shoulder joint. Okay, some other different ones that will help with the shoulder pain in that area would be from here. You want to stand with one foot next to a wall, and all you're going to do is slide your arms up, let your body come right towards the wall, get those arms up as high as you feel like you're able to without feeling tightness, and then slide back down. I'm doing a Y. And you work through about 10 reps on that one. Next, we're going to get some movement where we're going to open up that thoracic area. So you're going to slide the arms up, bring the arms back. So I'm trying to feel that back there, and then slide down. So up, back, and down. And then you'd work through about 10 to 15 of that one as well. What I'm doing is I'm squeezing, and then I just rotate out without changing any of my neck alignment, and then coming all the way back. If you have a band, it works great. So you pull, and then just open up that shoulder. Really good in that area. They keep opening up through it. Okay, so those ones work really well as far as both the rotator cuff and the impingement, any type of shoulder pain that you're experiencing. And then the last one I want to show you is by releasing in that area. So grab a tennis ball, you want to lie down on the ground and just kind of get the lats and then get your shoulders. So let me show you that. So we have a tennis ball. Let's say if my pain is here on the left side, let's start with the lat muscle. So I'm going to bring it down in through here, and there I can kind of find a good spot right through there. So I leave this thumb up, try to relax the shoulder. If you're able to do this type of movement, it's very beneficial because those lat muscles want to pull forward with the posture side of things. Then you're going to lie back. So you hold that one for a little bit, work on some good big deep breaths, and then you're going to cross this shoulder down. Make sure your neck's not straining, so you want to tuck the chin down, put something under your neck for support, and then just try to relax. So those are some different great exercises. Treatment, diagnosis, you might be able to kind of get a feel for what's taken place. If you do experience some of the pain in those areas, definitely seek the help and the treatment. As a personal trainer, I work with people once they are cleared to exercise. So that's kind of the function and what our scope of practice is as personal trainers. But a personal trainer can make a big difference as well, because they'll show you how to get some different movements. There's a lot of exercises I did not cover, but hopefully that'll give you some good basis and that'll help you. Thanks so much for joining me, and I'll see you again soon.